I'm Sonia Azad. Welcome to The Shift, a place to inspire growth, resilience, and wisdom, real connection, healthy conversation as we navigate life's changes and challenges together. Because, as I like to say, we are all each other's teachers. Thanks to our friends at the Villages of Lake Highlands for making this podcast possible. Hair and makeup generously provided by Glam House Collective.
Hello and welcome to The Shift. I'm Sonia Azad. Today we are at Texas Health Fort Worth and I am with Dr. Claudia Perez, neurointensivist. What does this mean, neurointensivist?
So I'm a board certified neurologist and I'm also board certified in neurocritical care. So primarily I take care of patients in the hospital and whenever they come in, they're pretty sick. They're neuro patients that end up in the ICU.
Mm-hmm. So first of all, thank you so much for your time today. We'll be talking about strokes and also in particular mini strokes. And something that I shared with Dr. Perez is that this came to me because my mom had a mini stroke and I found myself thinking, I don't really know much about that. I don't know what to do for her, what to tell her to do in order to remain healthy so that it doesn't turn into something else. So can we start with just what is a mini stroke?
Yeah, and so one of the things that we're trying to move away from is actually the term mini stroke.
Oh, interesting.
And
okay.
be more specific in calling it a transient ischemic attack.
TIA is what I've heard.
Yeah. So you may have heard that word, and that really is what it is. And so the big focus is on realizing that a transient ischemic attack is really a warning sign that should really signify to somebody something like impending doom, right? What it ends up being is a blockage of a blood vessel that's going up to the brain that is relieved. That blockage is relieved. So the person may have symptoms of a stroke, but then the symptoms resolve. If it was a clot that was in transit, that clot might have dissolved. And so here, the big warning sign is something could be coming on. And so the goal is to try to get somebody to the emergency room, because if you do end up having a full-blown stroke, you want to be somewhere where you could be treated immediately in order to reduce disability. The other thing is, if you don't end up having that stroke, you can really think about what are your risk factors for having a stroke and how can we prevent a stroke from happening and really reducing disability for the individual.
What are risk factors that you're talking about?
So the typical, what we would call cerebrovascular risk factors are things like having high blood pressure, cholesterol, things like diabetes, and not only having these conditions, but not controlling them with medications and treatments. And so kind of assessing your risk for those risk factors. Other things like obesity. So really thinking about things that make blood vessels unhealthy.
And you know, my mom does have high cholesterol, but she's on statins, high, blood sugar levels, glucose levels, medication for that. There's a lot to manage. And so, I always talk about prevention. Is this preventable?
It is. Up to 80% of strokes are preventable by making sure that you're addressing those risk factors. The other thing is that if we can prevent those conditions from even beginning in the first place, that's where we are thinking more about just in general having a healthy brain over the lifespan. So things like being very aware of your diet, things, more of the lifestyle things, right? Like diet, physical exercise, sleep. A lot of the things that we don't always typically think of that ultimately can lead to things like high blood pressure and just maybe unhealthy lifestyles that lead us to high cholesterol, diabetes, and things like that.
Well, it was so wild because the way that this happened in our family was, and I was actually at home, she woke up and was like, my eyesight is weird in this one eye. And, it just feels kind of blurry. And I thought, maybe you're just waking up. Maybe it's, just give yourself a little bit of time. You didn't sleep as much as you should have. Maybe you need rest. And I felt like I kind of brushed it off. And And I did not think that it could have been anything else because she didn't have the classic, like I think of FAST, the acronym FAST. She didn't have any of those symptoms, but I feel like with TIA, it's a little different.
It's a little different, and so we've actually expanded the FAST to really include the B part. So BE FAST.
Oh.
That actually puts in there some of the other symptoms that sometimes can be a little bit more vague. And so B FAST is for changes in B balance.
Okay.
E for eyesight. Yeah, and so
I'm like, oh, if only we had talked about this before. Yes, okay.
And so the incorporation is kind of those symptoms that don't always yell out stroke. They could be something else, and kind of like what you said, maybe there's just something wrong with your eye, but really recognize that even things like balance, eyesight, along with the traditional symptoms of facial drooping, arm weakness, speech difficulties, all those things, we kind of have to look at all of it. Mm-hmm. And so I think that kind of bringing more awareness to some of these minor symptoms and recognizing that everybody experiences a stroke a little bit different, and especially in women. So sometimes a woman may feel more a sense of just like fogginess, and it can be more of a vague symptom. And this is something that's been seen in studies that, just like in heart attacks, sometimes women have atypical, what we would call atypical presentations. It's more of just a nausea. It's just a sense of not feeling right, and so sometimes it can be difficult to recognize whenever, a stroke or a transient ischemic attack is happening.
And I feel like I've read, for ages, I've read that women are often quick to either say, I guess, brush off the symptoms, or even what I did. Oh, well, don't worry about it. Maybe you just need rest. And how do you know if you're kind of over worrying about something versus, or is there such thing?
I don't think there's ever a time of over worrying. And I think especially if you have those traditional risk factors, you have to be a little bit more in tune with your body and kind of be quick to recognize whenever something doesn't feel right. Mm-hmm. Because what's the worst thing that's going to happen? You're going to go to the doctor, they're going to see you and either reassure you, or if there's something going on, kind of look further into it. So I would say that we need to take kind of the cues that our body are giving us seriously and recognize that whenever it doesn't feel right, we probably should reach out to someone.
Mm-hmm. And then what do you do, let's say, the biggest question I had right after her experience was, okay, now what can I do for her, or what should I be telling her to do for herself? We've definitely emphasized lifestyle things, but is there anything to do from day to day that would prevent a stroke from happening?
I think it's really recognition of those health conditions, especially for her. Yes, she has the high blood pressure, but where is it? How well controlled is it? Where is the cholesterol? How high are the sugars? So that's big, right? So that's kind of recognizing those disease processes and making sure that we have them under control. Mm-hmm. And then the general things like making sure that, you're trying to make sure that you're having a good diet. And one of the models is a Mediterranean diet. Mm-hmm. So thinking about more, fresh fruits, vegetables, leaner meats, healthy fats. So fats aren't always bad, but we have to choose the healthy ones. Things like active lifestyle. And I think one of the big things that's coming out more and more in the literature is making sure that we're taking care of our sleep. Sleep has, a healing properties, and really kind of focusing on all those things that we don't always think about. And I think more than that, once somebody has had a transient ischemic attack, we think about adding medications like aspirin. So these are medications that help make it less likely for clots to form. So they're called the antiplatelet medications.
I'm so glad you mentioned that, because I think that it can be confusing for people. Like, they've heard aspirin's bad, they've heard aspirin's good. So what is the latest sort of medical advice and research directing us to do?
Yeah, so one of the big things that came out within the last, I would say, 5 to 8 years was that there was a high use of aspirin and not the right patient population. So whenever you didn't have all the risk factors, or if you had never had something like that primary stroke or a transient ischemic attack. So we really want the aspirin to be for what's called secondary prevention. So once somebody has had an event. So primary prevention, the thing that gets us to never, where we're trying to prevent this event from ever happening, really relies on making sure that you're taking care of those medical conditions, that you're, and the lifestyle changes. Aspirin tends to be more of what's called secondary prevention.
Okay.
So once an event has happened, similar to things like heart attacks, you usually take them after you've already had it, unless you happen to be in a very high risk category where you've had that discussion with your cardiologist, your neurologist, or your internal medicine doctor that puts you at a higher risk. But it's not typical for primary prevention.
That makes sense to me, just having you explain it like that. And I'm also just reminded to share, please take your medications, right? I mean, there's so many people who don't keep up with all of that. And now with the use of continuous glucose monitors, I think that's a really nice way for people who have type 2 diabetes, like my mom, to make sure they're within the appropriate ranges, that they're taking all their medications at the right times and with food or without, I mean, it's a lot to navigate too when you're on multiple medications.
It can be. And I think that a lot of the other work that's being done is kind of finding agents that maybe last longer. So it's more of a once a day kind of use of medications, because it is a lot whenever you have to take multiple pills. The other thing is remembering that medications can be a bridge while you are fixing those other kind of behavioral lifestyle changes. And so the goal is, especially early on, whenever you first get those first readings of high blood pressure, of cholesterol, that through diet and exercise, you can actually modify those numbers and may be able to come off medications. I think that the issue ends up being whenever we live with these conditions over the long term, and then it's harder and harder to get off medications. But if we need the medicine, we need to take it.
Yeah.
But remember that early recognition can mean that we may even be able to come off medications if we can just make the lifestyle changes. And I think that's a big take-home message.
Yeah, it's a good goal. It's a good intention to set, no matter at what age.
No matter at what age.
Okay, that's really promising, and it's nice to hear that. And I know, my mom is in her 70s. I'm in my 40s, so now everybody knows. Now you know. But you're seeing the patient population get younger and younger and younger when we talk about stroke. What is happening?
And I think that's where, this idea of early recognition is really going to be key. And so we are seeing a lot more stroke in younger patients. And so just for a definition, whenever we say young patients, we really mean patients who are, under 50. So the population.
Still young. Okay, still got it.
49 and younger, right?
Okay.
So what we're really, at this point, the younger patients typically have risk factors just like older patients, high blood pressure, diabetes, cholesterol, but it takes time for these changes to happen to blood vessels over time. What we are starting to see is what we would call premature atherosclerosis. So we're seeing changes in the blood vessels of plaques, like fatty plaques building up in people as young as 20 and 30-year-olds. And so I think in their 20s and their 30s. Wow. And so, the culprit here seems to be, lifestyle. So we're thinking about, childhood obesity going up. We're thinking of more having a sedentary lifestyle. And so this time, all these changes are beginning earlier. And so the time to stroke may be even younger. And so, we really need to start thinking even, as far as adopting healthy lifestyles for ourselves, and also, passing that on to our kids so that they remain healthy throughout the lifespan.
What do you think about all of these? Is there screening that can help? Because I feel like nowadays a lot of people are talking about all of these scans, the heart scans, and are there scans that can kind of show us what to do to maybe prevent some of these larger illnesses or events later on?
I think even before we get to a scan, we can think about things like just making sure that we have, I feel like whenever you're young, you're so used to, having access to your pediatrician and they're kind of keeping up with your numbers and you're getting blood checks. But as we get, into that transition of going into college and all that, there's a period of time whenever we're not seeing our primary care doctor pretty regularly, right? We're not having somebody check in to see how we're doing with our lifestyle. Maybe if we're starting to get those numbers that are a little bit high for blood pressure, kind of tracking that over time, maybe doing a lipid panel to see where your cholesterol levels are, thinking about getting your glucose checked, get your sugar checked, see, where you are in risk for diabetes. So I think even before a scan, I think that we need to focus a little bit more on access to healthcare for and that's a whole discussion in itself. But I think that's where we have the most ability to make change. It's bringing that awareness early on. And I do think that scans have their role as far as being able to see burden of disease, if there is any. But I think that after you've kind of had cholesterol for a while, I think that, if you're falling into that increased risk factor, you have a family history of heart disease, that maybe you would want to get those things checked earlier. But I wouldn't say scans at the onset.
They're not right. Yeah, that makes sense as well. I can't ignore the numbers that I've read when it comes to Black and brown communities being disproportionately affected. Is that a result of lack of access to healthcare?
I think that that's one of the big keys. I think it's also lack of education of how these lifestyle risk factors end up impacting somebody's healthcare in the long term. I think access to healthcare, because a lot of the patients don't have that primary care doctor, they don't have insurance, and I think that it's kind of a combination of multiple things. Some things that are cultural as far as diets are concerned, and sometimes not the focus on more active lifestyle and thinking about those topics.
Right. Yeah. And especially women in these communities, they tend to give to their children and to their spouses and kind of put themselves on the back burner, at least based on what I've observed and witnessed and all people I've talked to. And so, yes, like getting out and going for a morning walk is really important, and cooking maybe with different oils, for instance, can be helpful, and less sugar a little bit. But if you had one piece of advice for everybody out there who's listening, watching, anything, what would you say is the one thing everyone can do right now to create a little bit of change or start change?
I think it's really concentrating on what is it that I'm doing today. Like really looking at where am I as far as if I'm thinking about not only health, thinking about my overall brain health, right? What are the things that I can do? I think it's kind of looking at where you are as far as where are you with your diet? Are you actually kind of incorporating those changes? If not, maybe you don't know what the changes are, right? So kind of finding literature to help kind of guide that. And I know that sometimes thinking about things like, access to fruits and vegetables, we know that sometimes that isn't very easy depending on which communities you live in and what zip code you live in. But I think that there's a lot of initiatives to try to kind of have access for patients. So kind of looking for resources, right? The first part is educate yourself on it, and then know that there are resources that are geared towards trying to get you to those resources. And I think the other thing is just thinking about, whenever we think about physical activity, like you said, it doesn't have to be things like I'm going to go to the gym, or I have to get a membership, or it's because I don't have a treadmill at home. It's just taking those 30 minutes to take a walk, in the park with your kids. And I know that sometimes it can be difficult, right? Because if you kind of set your time, which you have the right to do, but it might feel a little bit selfish, right? So make it like a family activity. And that goes back to the idea of this increased obesity in childhood. The more we model for our kids the active lifestyle, the more likely it is that they will adopt these changes over time.
Yeah.
So I would really focus on those things. And getting to a doctor if possible. There's a lot of mobile screenings that sometimes are available, community fairs where you can have, blood work checked. If you don't have the access to get to a primary care doctor, kind of get some of those screenings. So.
Yeah, I think that's really important. And it's hard sometimes to connect to the resources that you're talking about. I try to do, some Facebook posts and posts on different platforms just because I think sometimes people might catch it there as opposed to somewhere else. So I like being the connector in that way. Just a personal question for you. I'm wondering, how did you get into this line of work? What drew you to this specifically?
Oh wow, that's a big question.
A big question. We saved the big question for a little later.
So I think for me, it was this idea of, I started off as a neuroscience major. And so for me, it was kind of understanding the brain was this big, it was a big topic for me to look into. But I think once I kind of understood how important, all the concepts of things like learning, memories, how all that lives within this organ, and kind of making that translation of here's the brain, here's the things that we think of as are the mind, right? And kind of putting it all together really was like eye-opening for me. And then understanding more how diseases affect the brain, this tissue, but actually have a big effect on the person, right? Who you are as an individual, made me realize that a lot of our patients don't have access to that information. And even within the healthcare community, neurology tends to be this black box of, it can be, there's a word out there, neurophobia. There is all this, the not clear understanding of the brain. And so I think that for me, it was the idea of bringing information to the community, making sure that we could translate information to patients to make it meaningful so that they could use it in order to understand not only what's happening, but what are the things we can do to help ourselves. And so, it's kind of like a whole arc thing for me, where it's like I'm here hopefully to provide information that is useful for patients to help them whenever they're most in need, and hopefully kind of impact their lives in that way. So.
And where do you see your work going in the next 5 or 10 years? Is there something that you think, while I'm living on Earth doing this incredible work, that you have this talent, this gift, this skill, you've been put in this, position to help people. What is it that you really hope to see happen?
I think one of the things that I hope to happen is that we have better access to neurological care. I think even if we look in the last 20 years, there's actually leaps that have been taken in the things that we can do for things like stroke. A long time ago, if somebody was having a stroke, it was kind of like, well, we can give you some aspirin, hope it doesn't happen again. And there wasn't a lot of interventions that we could do. We are now in an era where if somebody is having a transient ischemic attack, if they come to the hospital and they're, about to have a stroke, or they go and they're having a stroke, there's medications we can give to bust up clots. There's interventions that can be done that can actually remove clots from the brain. And so we're trying to reduce disability in our patients. And so I think that that's an exciting part of, where neurology is in the hospital nowadays. We can actually impact people's lives, the outcomes that they have. And I think another big area is the world of rehab, because even after you've had a stroke, there's still hope. The brain has the ability to change. there's something called plasticity. And so, once at least you come here and we take care of you, from the time that you come to the ER to the time that you're in the ICU, we're already thinking, how are we going to get you to rehab? How are we going to get you to working on towards bringing back as much function as we can? So I think that's an exciting time for neurology right now, that we can do so much more early on, and that there's hope that the more and more we learn about how the brain changes, that we'll be able to kind of bring more effective therapies for rehabilitation.
And that's why it's so important to get care quickly if something happens.
Yes.
Yeah. Thank you so much for your time today. I really appreciate it. Thank you for the incredible work that you do. Not everyone on this earth is able to do what you do. So I always am so honored to be able to sit with people like you, clinicians, physicians who are helping countless people. Is there anything you want to add before we wrap things up? Any final thought that you want folks to know?
Oh, that's another big one.
Another big, she's like, I want everybody to know all the things.
Yeah, I think that, like what I mentioned before, right? The big move is to kind of think not only of things like, not only to focus on preventing strokes, but really thinking more about your general health and thinking about brain health as a concept that we move forward, from the time that we're kids.
Yes.
Just kind of how do we maintain our brains resilient through our lifespan? I'll tell you, even for things that are kind of unrelated, if you look at patients who end up having things like dementia, if they have the same cerebrovascular risk factors that are in control, their dementia actually gets worse faster than if you had those risk factors and they were actually controlled.
Yes.
So there's not one thing that's working independently of each other. The healthier our brain is, the more reserve we will have, the more resilient. And so I think that starts early on and should continue throughout the lifespan.
It's all connected.
And so I think that's the big message, I think. And here at Texas Health Fort Worth, like I said, the arc begins from the moment that somebody comes to the ER, making sure that we have those neurointerventionalists that can, if you need it, take out blood clots from the brain, all the way to, if you need the ICU, we're here to kind of prevent any secondary injury to the brain, to thinking about how are we going to get you to rehab? How are we going to get you kind of to the next phase of care? And that's something that we take very seriously, because we are, at this point, the highest serving stroke center in North Texas. And so we are committed to making sure that we have a strong neuroscience program to ensure that our patients have better outcomes.
Well, I think that people are growing more and more fascinated with brain and brain health, neurology overall. So I do think that, and myself included, so I think that we're constantly kind of on the forefront of more. And it will be fascinating to see where things go 5, 10, 20 years from now. So thank you so much again for your time today. Really appreciated the chance to talk to you.
Well, thank you so much for bringing awareness to this really important topic.
Okay, and if you guys have questions, comments, please leave them in the comments section. We'll be sure to get them to Dr. Perez. For now, I'm Sonia Azad. Thank you again for watching The Shift. Remember to like, share, and subscribe. We'll see you next time.
Today's podcast is sponsored by my good friends over at the Villages of Lake Highlands, one of the premier senior healthcare facilities in town. It's part of a campus offering a full array of senior services, including independent living, short-term rehab, skilled nursing, memory care, and outpatient therapy. Kelly Wolf and his wonderful team of physicians, nurses, and therapists provide outstanding, compassionate care. The Villages carries Medicare and Medicaid's highest rating, and they're consistently identified by U.S. News & World Report as a best nursing home. That's an honor given to less than 5% of all nursing homes across the country. The facility is beautiful with a warm and inviting decor and lushly landscaped courtyards. They provide tons of wonderful services, and the care is absolutely top-notch. Whether you're looking for yourself, a spouse, or a loved one, please consider Villages of Lake Highlands. You can check them out at volh.com or call 469-983-2330 to schedule a tour. And don't forget about our friends at Glam House Collective. Let's get glam.